the secondary infections. What are the infections and why are they there? Today, we're going to be looking at the actual infectious process, but we're going to be adding layers on this and try to identify the underlying primary triggering event, such as allergies or endocrinopathies. So what are the infections and why are they there? The two most important questions for any dermatologic patient. Okay, so the first part of these infectious diseases is folliculitis and furunculosis, and this is infection of the hair follicle. And when it's a mild infection with a papular mosquito bite looking lumpy bumpy rash that crusts, that's folliculitis. When the hair follicle ruptures and we actually have pus oozing out of the skin, that's a version of cellulitis, but because it's a ruptured follicle, that's called furunculosis. Knowing folliculitis, we're going to treat in the 21 to 28 day span of the epidermal turnover time. Furunculosis is going to take much longer, potentially up to 3 months, to completely get rid of the infection and let the skin and the hair follicles heal. There are three causes of folliculitis and furunculosis, and that would be staph bacteria, pyoderma, demodicosis, which is a follicular parasite, and dermatophyte, which is ringworm. And there's a couple of species of dermatophyte. And we're going to talk about all three of these today. The problem that we have clinically is that regardless of the cause of folliculitis and furunculosis, whether that's staph bacteria, pyoderma, demodicosis, or dermatophyte ringworm, they all can look exactly the same. So here we have different images of sort of this moth-eaten appearance hair coat. Here we have so almost what looks like a hot spot with this epidermal collarette, the flaking scale that's going around, and that's part of the healing process with hair loss. Here we have more of a papular rash with crusting. And then this is just a little bit more severe with early papules going on, and then more aggressive crusts. And if I pick the crust off of that and squeeze, we'd probably get a little bit of pus that may represent some furunculosis. So how are we going to tell these three etiologies apart if clinically they can look exactly the same? So clinically, you cannot differentiate these causes of folliculitis, and you have to do cytology and various additional diagnostic techniques to figure out the etiology. Saying that, this dog has dermatophytosis. It was digging in some mulch and developed a soil-borne dermatophyte, which is a type of ringworm. Not all ringworm comes from cats. This dog has demodicosis, and we do a skin scrape to find the mites. And then this guy has perioral dermatosis caused by staph bacterial infection. So clinically, they can look exactly the same, but we're going to have to use diagnostic techniques to identify the path. We're going to perform various diagnostic tests. So if you remember, here's the dog with the moth-eaten hair coat. Here's the papular rash. And then this one had the mild papules with the furunculosis. So we're going to do a skin scrape looking for Demodex. We're going to do microscopic cytology looking for these staph organisms. And then we're probably going to do a fungal culture, a DTM, dermatophyte test media, fungal culture, or DNA testing looking for ringworm. So here we have an impression smear. This dog actually has pemphigus foliaceus, so it's on the nasal planum of the dog. And so we might be looking for acantholytic cells in this guy, but we're also going to need to look for bacteria to determine if there's a secondary staph pyoderma making the symptoms much worse. So we're going to peel off the scab, and what we're trying to get is the moist pus oozing material underneath. So we're going to stick the slide on there, let it dry, and then stain it and look under the microscope. I use a lot of tape preps. This is clear. It has to be the clear, not that magic tape that's kind of frosted in appearance, but crystal clear tape. And you take a piece of that and you stick it on the skin in between the toes on the papular rash, and then you stain it using our DictQuick stain, and then place it on a microscope slide and look at it under high power. And what we're looking for with bacterial pyoderma would be neutrophils, so these segmented cells. We have nuclear stranding here, and these are fragile, dead neutrophils that when we do our cytology prep, we destroy the cell, and when we streak it out, we get this stranding material. And that's evidence of neutrophils that have been toxic doing their job and have died. And then we really like to see our staph organisms that are these little cocci stuck together in duplets or clusters of 4. Ideally. So again, I can't look at this young dog and tell that this is Demodex without doing a skin scrape, but certainly the age and the generalized presentation of the symptoms would suggest that possibly it could be Demodex, but ultimately I can't tell the difference between dermatophyte infection or staph pyoderma. To do a skin scrape, there's a big to-do made about whether it's a superficial scrape for scabies or superficial mites and lice versus a deep skin scrape, which would be more for Demodex. And what I would really rather have you focus on, rather than a superficial or deep concept, is what is the mite that you're looking for? Is this folliculitis furunculosis that we need to get down deep into the follicle where the mites are actually going to be living? And that would be a deep skin scrape, versus is this superficial on the skin, for instance, like a scabies or notoedrus mite, where we just need to kind of scoop that up. So the classic skin scrape is that we want to scratch the surface of the skin with a sharp object, usually a dulled scalpel blade, but you can use various spatulas that are designed for this, or even the edge of a microscope slide is sharp enough to do this. And then you're going to squeeze the skin to squeeze out any Demodex mites out of the deep part of the hair follicle, and then you're going to scoop up the goo. You're using a lot of a generous portion of mineral oil to sort of act as a vehicle when you scoop up the debris to look at under the microscope. You're going to look at this under 10x, and should easily be able to find the mites if they're there in dogs. It's harder to find mites in cats. But here we have eggs, we have immature stages and adult stages. And if we look closer on the skin, we have all the evidence of folliculitis. So we have crusts, we have alopecia. We even have some kind of circular lesions here. And in this case, it is dermatophyte, but staph pyoderma is actually a much more common cause of folliculitis in dogs. To diagnose this, we could use a variety of techniques. Wood's lamp are very ineffective. It's sort of an old school technique. And at best, this is only going to be 50% diagnostic for Microsporum canis. So it's not a very useful tool. We can also do a microscopic examination of the hair itself, looking for invasion of the hair shaft with the microconidia, but that also is not very accurate, probably 50% at best. So it's a very low yield diagnostic test. We could do a DTM culture, and DTM uses a special culture media that turns red as soon as we have the white fluffy dermatophyte growth, and that's because of a pH indicator that's in the media. And then what we'd want to do is confirm the diagnosis and identify the species by getting a sample of the fluffy white material and putting it on a microscopic slide, looking at it under high power, and we're looking for these macroconidia. The macroconidia are only identifiable from a culture plate. So if you do skin cytology on a dog, tape prep or press the slide on the skin of a dog, and you see something that looks like this dermatophyte macroconidia, since it came directly from the skin, we know that it's not a dermatophyte and it's probably a pollen spore or fungal spore of some sort. So macroconidia from dermatophyte can only be obtained from the culture plate. The better way to diagnose this would be with DNA testing. Here's a close-up of the elephant skin lichenification, and this is pretty much pathognomonic for yeast. The way we find yeast is with skin cytology. That crystal clear tape prep works very nicely. It's easy to get in the armpits or in between the toes without worrying about causing laceration with the sharp edge of a slide. So you stick it down on the skin, collect any goo, and then you stain that with our Diff Quick stain, and you can identify the little Malassezia organisms that look like footprints or drumsticks. This is a lot of yeast, and this is much more typical of what we'd find on an ear swab than a typical tape prep. So we may have very few organisms actually on the surface of the skin because the animal has developed a hypersensitivity to the actual yeast. The other thing I'd like to point out that's somewhat of a subtlety is that we're all looking for these classic drumstick footprint shaped yeast organisms, but if they haven't budded yet, or if they're on anti-yeast therapy, we're going to get a variety of shapes from round to non-divided little football shapes. So we need to sort of expand our interpretation of the cytology and not just rely on that classic budding footprint drumstick pattern.